Why does it take so long to fill prescriptions at a pharmacy? So imagine this, you drop off your prescription at the pharmacy and you're told it's going to be about 15 to 20 minutes. But why? Just count to 30, put them in a bottle, and you're good to go, right? Well, imagine this scenario, which is the scenario the vast majority of the time. So there's two patients who dropped off their prescriptions before you. You are now third in line to fill. You decide to do some shopping. The pharmacy tech realizes that the doctor forgot to write the quantity of tablets on the prescription, and the pharmacist now must call the doctor to clarify. In the meantime, the tech is inputting the other prescriptions. During the phone call to your doctor, another two patients arrive at the drop-off counter to fill their prescriptions. The pharmacist hands the verified prescription back to the tech, but then insurance denies the claim, stating the date of birth on file at the pharmacy, which is the date of birth written on the prescription, is not the same as the insurance company. So the tech calls you back to the pharmacy to verify your date of birth. In the meantime, the other two prescriptions that were originally behind you in line have now moved up front because you haven't come back to the pharmacy yet. You finally come back and find out the prescription is nowhere near being finished, and you give your correct date of birth. It's behind the other two prescriptions now. The pharmacist flags one of the prescriptions as the duplication of therapy and must call the provider to ensure the patient's not taking both. The doctor clarifies the patient should replace the old prescription with the new one, and the pharmacist just makes a note to counsel the patient about this when they pick it up. The pharmacist finally gets to your prescription, but the phone rings, and a new patient has a question about side effects of a medication. When done filling your prescription, she puts it in the ready box and gets a consult for the patient whose prescription was changed. The patient finds out the new medication costs $50 instead of $15, like the old prescription, and requests the pharmacist call the provider back and change the prescription back to the old medicine. Your prescription is ready, so your name is called to get in line, but the person in front of you is picking up their prescriptions and asks a question about over-the-counter medicines, and the pharmacist must come consult and help the patient find the product. In the meantime, two more patients drop off prescriptions. You finally make it to the pickup window to pay for your prescription. It's been 35 minutes. You're upset and tell the staff it's not that hard to count to 30 and put pills in a bottle. So next time you're at a pharmacy, remember these people are working hard to ensure your safety first while trying to efficiently fill over 400 prescriptions per day. Thank your pharmacy team.